Welcome back to DXB today. Whether it is acupuncture, Ayurveda, or energy healing, we are here with an open mind to find out what truly works. Now, we hear so much about alternative remedies when it comes to cancer prevention and treatment, but many doctors won't subscribe to holistic remedies because they have never studied them. But our next expert is a naturopath, oncologist, specialist, and a cancer survivor herself. Please welcome to the show, Dr. Heidi Kussmann. Dr. Heidi, thank you so much for coming on the show.
It's a pleasure to be here.
Your story is so fascinating, it gives me chills almost just thinking about it. So you're a naturopath oncologist. I'm no expert, but from my understanding, naturopathy is basically including natural remedies into your lifestyle. And as a cancer survivor yourself, how would you say these therapies complement traditional treatments like chemo and radiation?
Okay, so I'll explain a little bit about my training as well in naturopathic medicine because it's a little bit different than what a lot of people understand. I'm a Canadian trained naturopathic physician, which is the same as primary care level of medicine with the additional years of botanical medicine, clinical nutrition, homeopathy, acupuncture, Eastern and Western botanical medicine, and then some physical therapy modalities added. So when we graduate, we have a license and we go from there to practicing in a general or internal medicine family practice style, or you can specialize. And so I went on to specialize in oncology, and I had been practicing and have been practicing for over 20 years now. I'm not going to tell you exactly how long, but I've been practicing a while in naturopathic oncology, which is a subspecialty of the integrative therapies that surround cancer care. So my work is helping people at the start of diagnosis, preferentially. We can get them ready for their treatment, whether it be chemo, radiation, or surgery, or targeted therapies, immunotherapies, those types of things. Help them through. I have, very broad, helpful list of side effect management options that people can use, and then also to work on the recurrence prevention side so that when they finish their treatment, there is more that can be done, and that is our best opportunity at that time to prevent that recurrence.
I wanted to ask you about the holistic approaches and maybe supportive treatments that you give cancer patients.
Yeah, so if in the example of someone's getting chemotherapy for breast cancer, that's typically an 18-month treatment plan from start to finish, diagnosis until all the treatments in the conventional side under standard of care, NCCN guidelines have been completed. Sometimes it can be longer depending on the staging. But what I'm doing is helping them establish proper nutrition. There are certain nutritional, not necessarily diets, I don't like that word, but there are certain levels of nutrient status that are required in order for you to optimize your metabolism around different cancer therapies or radiation therapy, for example. And prepping for surgery is kind of like training for a race because there's a certain amount of cellular stress that you put on your body when you're under anesthesia and you're having procedures, and then there's the wound healing part. And so, for example, some of the things that I look at are what is your insulin and glucose levels are in your labs. If you tend to have elevated glucose, you're at risk for complications with wound healing. Because not that you need to be diabetic, but there's an issue that has to do with delayed oxidation and higher risk of infection.
So I just want to ask you one thing. So when we are dealing with breast cancer and breast cancer patients, so what is exactly you work on that the disease will not progress?
So you mean recur or progress?
The progress. There should be no proliferation further.
Yes.
There should be no growth. How you come to a conclusion of understanding how to stop it?
So we work with the standard chemotherapy radiation surgery plan. I usually don't encourage patients to do otherwise. We start with that and we layer on top of it the necessary metabolic and immune support to prevent the pathways that have become altered in cancer cell signaling that promote its own growth. We work at shutting those off.
Okay.
So I'll use things, for example, in breast cancer, you can get carbotaxol 4 cycles as a neoadjuvant chemotherapy regimen. The taxanes and the carboplatin, they each have their side effect profile, so people will get a side effect sheet that gives them specific details. If you develop this, then do that. And then with platinums, they can be renal, they can be toxic to the kidneys, and so we work on supporting kidney health. If they get the taxanes, neuropathy is often that comes up. This is all about side effect management. Now, Dr. Ash, you were talking about how to prevent progression.
Yes.
So that comes into the metabolic and the immune pieces.
Yes.
So I'm looking at what exactly is driving the fuel supply for these cancer cells, because they exist on fuel. There's something that's allowing them to metabolize and reproduce and keep going, just the way our healthy cells do.
Yeah.
In cancer, it is known, Otto Warburg has developed and had developed, and his theory, he won a Nobel Prize for this, has to do with something called fermentative glycolysis. It's an altered form of metabolizing glucose. But glucose does not cause cancer. I want to just clarify that.
Yeah, it's just a feed to the cancer cells.
That was sort of taken and spun off from that fermentative glycolysis piece. You have cells that are constantly being repaired, and they use fuel as part of that repair process. Cancer cells don't have an off switch that schedules them for cell death. So they just keep on reproducing and going and going and going, and they don't necessarily abide by the same rules as healthy cells do in that sense. So my work is where in your lab data, based on your blood work or imaging or molecular profiling, where are the targets that I can specifically intervene with using the therapies that I use. And I'll use, sometimes I'll use specific diets. The one with the most evidence in cancer is the Mediterranean diet.
Yeah.
But there are other botanicals that I can use to support the prevention of progression or recurrence. Those have to do with things that support the immune system. Specifically, I use things like mistletoe therapy, which is an injection therapy, or an IV therapy.
Yeah.
Other therapies that I use are high-dose pharmacologic ascorbate or high-dose IV vitamin C. So you can see there's a difference between oral dosing and injection in the effect that it has on those cells. So at a cellular level, when you provide something in oral dose, the absorption is about 30%, versus when you do an IV therapy, it's a 100% absorbed, completely therapeutic effect.
Yeah.
So the end result is you actually are more efficient in giving the dose. And what recent research has shown that when you do high dose vitamin C, you actually create an advantage for healthy cells. They can use that to restore and regenerate themselves, but cancer cells don't have a specific enzyme that breaks this vitamin C down properly, and it ends up damaging the DNA of cancer cells. So we provide that before chemo, and then we provide it after chemo. And so it's a 1-2 step of maximizing the efficacy of our conventional treatments as well.
Wow.
We all want to hedge our bets when we are diagnosed, and I want to make cancer a bit more of a normal conversation for people to have as well. There's a lot of stigma and fear with that, and I think that we need to understand that this is just a group of cells growing out of control, and you can influence it with the choices that you make every day, with your lifestyle, and you have to employ all the treatments available to you as well, as long as there's evidence to support them.
Absolutely. Dr. Heidi, that has been truly informative, and I really, the biggest takeaway for me from everything that we've conversed about earlier is how you said that before we go for surgery, it's like preparing for a race. And I've been on the operating table quite a few times. I never thought of it that way. So it's good to know that we have all these options for us now so that we can prepare for ourselves, or if ever, touch wood, we have to
just
go
to
the
add,
operating.
because I have been doing a cancer research in India. So I have been connecting why do the cells multiply? Why not with everybody there is proliferation and only with few people? So breast cancer, German medicine and homeopathy comes to an understanding that breast cancer is stimulated by nest worry. Worry about your nest, your home. When your child is suffering a lot and you are not able to do anything for your child, and there is something which is stressing you, which is making you feel that your child is not being fed properly, your prolactin levels go up, and that stimulates the glandular proliferation, and that's how things go up. So the reason behind proliferation has to be understood. That's what is coming from the psyche. If you understand that psyche and make that person aware that you stop worrying of your child, he is already a grown up and he can feed himself, their stimulus and proliferation there and there stops, because the patient comes to know why she is having this breast cancer.
Dr. Ash and I are already taking notes right now. Thank you so very much. Dr. Heidi, thank you again.
Thank you.
But I know, Ahmed, you have something a little special prepared for Dr. Ash right now?
Yes, I do have the DXP in 60, so it's a rapid fire questions just to get to know you better in 60 seconds.
Okay.
Are you ready?
I'm ready.
Okay, I'm going to cue the clock
Shoot.
in 3, 2, 1. What was your first job?
As a RMO, registered medical officer in one cardiac care center.
Cool. And what is your motto in life and in work?
Mission is to reverse almost all chronic diseases and make people aware that they don't have to fear diseases. They have to just know the disease and get out of that situation.
A goal you have for 2025?
Making Dubai almost pill-free.
Okay. What is the most surprising recovery you've seen through your work?
The most difficult was a celiac disease, and the girl had a small uterus, which they said she will never be able to get married and get pregnant. And with German new medicine and homeopathy, we could completely recover, and now she is a mother.
Oh,
wow,
that's amazing.
beautiful.
Why Dubai?
It's like Dubai is educated, they understand what the world is changing, and they are ready to adapt.
Great.
Dr. Asher, this has been so exciting to see you outside of the clinic. I know where to find you, but for the rest of our viewers who don't know that, where can they come and meet you in Dubai?
It's Wealth by Medcare at Jumeirah, Al Aruba Street.
Fantastic, and can't wait to see you again, and hopefully you can come back in your next visit here to Dubai.
Sure.
And Dr. Heidi, it's been a fascinating story. Thank you so
you.
much for coming here, sharing your journey and all the important tips.
Thank you.
Time now for a quick break. After that, we have a fantastic performance by our talent this evening. Watch out for Christine.